We're happy to have with us former Lieutenant Governor of New York, a great lady, Betsy McCaughey. And I want to get right to something you just talked about. He's promising seniors that this will not hurt their Medicare, but I'd like you to talk about the bonuses and demerits for treating seniors in Obamacare.
That's right. The president has said again and again that he's only cutting payments to hospitals, not seniors' benefits. But you shouldn't be bamboozled by that. It's really just a trick and illusion, because this law takes $247 billion out of what hospitals would have to care for seniors over the next decade. In other words, the hospitals have to care for the same seniors with hundreds of billions of dollars less money. And we know it's going to mean fewer nurses on the floor, waits for MRIs, less room cleaning, less physical therapy, and higher death rates. Because research sponsored by the Federal Institute on Aging, by RAND Corporation, published in peer-reviewed articles, this is not political research, shows that patients treated at low-spending hospitals are less able to recover from their illnesses. For example, elderly patients treated at low-spending hospitals have a 19% worse chance of recovering from a heart attack and going home, whereas someone else treated at a higher spending hospital for the same kind of heart attack recovers and goes on with life. And yet, despite this evidence, the Obama administration is actually awarding bonuses to the hospitals that spend the least per senior and whacking the other hospitals with demerits for spending more, even penalizing hospitals for recommending physical therapy once the patient leaves the hospital, or recommending a follow-up visit with the doctor, anything that costs money in the 3 months after the patient is discharged from the hospital. So we know that these penalties are going to cost seniors their lives.
We have had many attempts, I think all of which you've read, to institute national health care, universal health care, government health care over the years. I don't recall this being part of any of them. Is this new to Obamacare?
Oh yes, Section 3001, which rewards hospitals that spend the least on seniors. This is brand new. It's a brand new regulation put into Medicare. It goes into effect October 2012, and it's going to have a very detrimental effect. We know from looking at the data that in one state, California, almost 14,000 seniors died at low-spending hospitals who would have survived their illness and gone home had they been treated at a higher-spending hospital that provided the care they needed. And yet the Obama administration, disregarding this evidence, is now forcing hospitals in all 50 states to imitate the low-spending hospitals that have the higher death rates.
How much of Obamacare has already gone into effect?
Only a small part. A small part of Obamacare has gone into effect. The two one-liners that you hear about all the time, leaving kids on their parents' policies till 26, and remedies for pre-existing conditions. But the severe cuts to Medicare, which pay for over half this law, the severe cuts that will harm seniors are just going into effect now. You won't feel the impact for another year or two, and then you will suddenly see in your hospital austerity. Not enough nursing care, not enough cleaners, not enough physical therapists, not enough nutritionists, just care spread too thin, and the result will be higher death rates from illnesses you otherwise would survive.
We should point out, too, that even without Obamacare, seniors spend about half the days in the hospital that the general population does under existing Medicare rules.
But when you hear the president tell seniors, as he's doing right now at AARP, don't worry, I'm not cutting benefits, I'm only cutting payments to providers, use your head. If hospitals have less money to spend on seniors, then seniors will suffer. They won't be able to recover from the pneumonia, the stroke, the heart attack, the congestive heart failure. We have the evidence in peer-reviewed scientific journals to show that if the money isn't there, seniors don't survive those illnesses.